So hello, welcome to Itenev's webinar. We're going to go ahead and get started. Today we're going to be presenting Making Sense of Your Reason Code Library. This is the 13th installment of our educational webinar series, and we hope you find it helpful and insightful. My name is Chelsea Grover, and I'm the Marketing Communications Coordinator for Itenev. I'd like to take a moment to explain the process for today's presentation. First, I'd like to mention that this webinar will be recorded. Next, I'm pleased to announce our upcoming webinars. The next one will be an industry perspective on telemedicine. It's going to take place on Wednesday, October 7th at 12 p.m. Central Time. We hope to see you at it, but if you can't make it, we will offer recordings of the webinar on our website. Finally, as I'm sure you can all guess, the minute that CMS announces the Meaningful Use Final Rule, we will create an in-depth webinar to go over the final changes, so keep your eyes open for that invitation. With its current overdue and pending status, along with the pressure that MGMA is putting on them, we are hoping it will be out any day now. Moving on to your Reason Code Library, some housekeeping notes. At the end of the presentation, we will open up the floor to questions from you. We will answer all the questions at the end, but you may type them in the questions area of the webinar control panel whenever they occur to you. For your reference, we will also be emailing links to the recordings and the PDF of the presentation later this week. Finally, for audio clarity purposes, everyone's phone will remain muted throughout the entire webinar. If you experience audio issues, please use the chat box to let us know so we can resolve them. And again, questions may be entered in the questions box. So without further delay, I'd like to introduce our presenter for today. Jeannie Logue has been in the industry for over 25 years and is the Director of Consulting Solutions at Itenev and one of our leading experts. You've likely heard her speak before, either on previous webinars or in person at UGMs and MGMAs. She has worked here for over 3 years and lives and breathes the industry and travels across the country seemingly nonstop, working with our clients at their locations. Her experience and during many client practice management evaluations, she has discovered that the Reason Code Library is one of the most underutilized tools, and she is therefore passionate to share the value it can bring to your practice. Jeannie, I'm going to go ahead and pass it off to you. Feel free to get started when you're ready.
Hi, everybody. Thank you for taking time out of your midweek to sit in on the Reason Code Library topic. This one is near and dear to my heart, as Chelsea explained, and it is one of the areas that I feel that within NextGen, it's a very, very powerful tool, and it's often just brought in out of the box, and that's how it's left in many practices. So what I want to do today is I just kind of want to talk about the Reason Code Library and really what does it do? Have you checked the accuracy of your Reason Code Library? Most of the practices that I work with don't even understand the impact or the value that you can get from this library with setting it up. So my goal today is to really just kind of bring to light, some areas that you can look at this, go back to your practices, open this area up, be able to start tweaking it a little bit and making it a valuable tool for you to use within your practice. So within the actual library itself and the maintenance library, Reason Code Library, this is a full screen, and we're going to kind of break these pieces down on what do they actually mean. So on the agenda today, we are just going to look at what is the library, what does it do for me, what does it impact, why should I make any changes to it, what does the priority actually mean when it says priority. On-the-fly codes, if you've got a lot of on-the-fly codes in there, why are they in there, how did they get there, and what do I do with them? How is your ERA posting impacted based on this Reason Code Library? And then in denial management, how can I use the Reason Code Library and the categories to start trending my payers or my denials to help me have clean claims the first time versus actually having these denials that we're constantly working? So how can it help my practice? And then we'll just run through a summary of what you can do to get started with this. This is not something that you're going to go back and immediately just start tweaking within a couple of hours and have it set. It is an ongoing thing. You really have to work hard at keeping your Reason Code Library functioning the way your practice wants it to. So first of all, what is it? All the payers are required to use the HIPAA-compliant reason codes in the ERA file to describe how the service was adjudicated. So what that actually means is when I am filing a claim to my payer and they're sending it back and I'm getting a payment from there, there's always an adjustment. Okay, it's a contractual adjustment or maybe a full amount adjustment, but there's something linked to it to tell me why they're taking that adjudication, why are they taking that adjustment. So the Reason Code Library gives us the practices, gives us the ability to configure our own business rules. So if the payer says adjust this off and we don't want it to be adjusted off, then we can make that decision and say do not adjust it off. So this Reason Code Library is going to give me the ability to say I'm not going to follow the rules, what the payer is saying I should do with this, until I do something different. I may want to appeal it, I may want to adjust it off, I may want to bill the patient. So the NextGen out-of-the-box Reason Code Library is set up to follow HIPAA guidelines from the payers. So it is basically saying if the payer tells me I am not supposed to get paid, I'm going to write it off in NextGen. And that really isn't always the case of what we want it to do. So it is, out of the box is going to follow the rules that the payers are saying this code is supposed to follow. So what does that actually kind of mean? So really just understanding reason codes in general helps us really get started with how we want to create the Reason Code Library to function for our business. So within this, you have the group code. So we're all used to kind of seeing what CO, CR, OA, PI, and PR is always going to be in front of one of our numbers. So what these actually mean, and I just kind of gave a definition, is trying to just really understand what that CO. So that's contractual obligation. So anytime you see a CO in a number, it's you have contracted that that adjustment should be taken. Still doesn't always mean that you want to take the full adjustment. You may need to look at something a little bit deeper with that too. But just kind of understanding a CR is a correction or a reversal. So anytime you see an adjustment with a CR code, it is some type of corrected claim, or it's a reversal of a claim you've already been paid on. The OA is other adjustment. That one is randomly used. Just again, it's other adjustment. So when it doesn't fit in the parameters of these other ones, you will see an OA code come through. The PI stands for the payer-initiated reductions. Again, watch closely. Why is the payer actually initiating an additional reduction? Is that correct or not correct? And then the PRs we're used to that. That means it's patient responsibility, and that's where you get the PR1s, PR2s for copays, and your deductibles. So all of these, again, the numbers are going to follow it, and the number's going to tell me what I'm supposed to do with it as well. But understanding the group codes gives us a little bit clarity of how we're going to set the roles up so that our system is actually working to our benefit. So then behind the actual claim adjustment reason codes, okay, and you'll hear these called CARC codes. Again, claim adjustment reason codes. If you ever hear somebody just talk about CARC codes, that's what they're looking at, is the claim adjustment reason codes. Then you're going to start seeing the numbers that follow. And again, I said PR1, PR2, PR3. Those are all going to be patient responsibility deductible coinsurance. Then you can start getting into the other ones. The procedure code is inconsistent with a modifier used. This could come in as a OA, other adjustment, or a CR or C. So you're going to have, you could have an OA4 and a CR4, depending on how the payers. So the number is going to represent exactly, what the problem is with it, but the actual code in front of it is going to be the definition as, is it a payer adjustment, or is it patient insurance or patient? Then we've got some additional codes, and you'll hear these called RARC codes. Okay, so they're the remittance advice remark codes. And what these are additional remark codes. These are actually additional information that now the payers are giving us to help us describe a little bit more on what's going on with the CARC code. So it really is saying, okay, we're going to deny this. We need additional information. And then you may have an M code or an N code that's actually attached to that as well, which is going to give us a little bit more information and help us work those denials. So I've just kind of displayed a couple of them here, that an M13 with only one initial visit is covered per specialty per medical group. So we may have an adjustment code that basically says non-covered, okay? So non-covered to me means, okay, am I supposed to appeal this, or is it really non-covered? Why is it non-covered? And if I have that additional M code, then it's telling me only one visit covered per specialty per medical group, then I can look at it and say, yes, that is correct. I am going to go ahead and let that adjust off because that patient did see a couple of physicians within my specialty group today, and I can only bill for one. So the M code's helping me determine what my denial was. So that I know whether I can work it without having me to call the insurance company and say, could you really tell me what additional information you're looking for, or why was this non-covered? So you're going to see those on your claims as well. So with the claim adjustments that we're actually seeing, we also have now, and this is pulled directly from your Reason Code Library, this is one of the top sections, is you're going to see that you have line item adjustments. So basically the reason code is going to come in and it's going to be a line item adjustment. So the two line item adjustments we have is our line item and our remark. Those are what we call line item specific. So I may send a claim with multiple line items, but if I get a denial or a on one of those line items, it may be just for that one line item. It's not going to be on the whole claim level. So understanding, again, some of these reason codes that come in, is it a reason code denial for a specific line, or basically is it going to be a reason code adjustment that's on the claim level? Okay, so when I talk about the claim reasons and the line reasons, when you look in your posting screen, you've got at the top, and a lot of times we kind of overlook that claim reason at the top. We're always focusing on the line items. So when you're looking at that, you may have a claim level reason code. Okay, so the adjudication is going to be for the entire claim. And what you see with that one is a lot if it's termed insurance. I mean, if the patient is termed, then every line item is not going to be covered by that payer because they're telling you they're termed, they have other insurance, and that would be a claim level reason code adjustment. And now the adjustment would probably be 0 because they're not going to pay or anything, so they're not going to adjust. So you really got to look at it and understand, is it on the claim or is it on the line item? So when you start looking at the line items, those are going to be down under your line item reasons, and you're going to see your CO45 or any of your remark codes are going to be line item specific. So really understanding, and I'm going to go ahead and just flip back one screen, understanding when you're in your Reason Code Library, whether the radio button is on line item, claim level, adjudication, or remark. So you may say, well, I already have OA97 in my computer, and I've got it set to not take the adjustment. Why all of a sudden when I get PI97 did it take the adjustment? Well, look at it. One's probably claim level, one's probably line item. So if you've got your line item set up correctly, the payer is now sending it in with the OA other or a PI, and basically it's not set up in your system to follow the rules that you want. So we often see that we have everything set up exactly how we want, and then that code comes through, and if you look at it, you've got to be really close and look, did it come through as a claim level versus line item where you have your rule set? Okay, so what does it do? Based on how we have these set up, we're going to kind of dig into a little bit deeper on how we can make this work better for you. Right now, if you leave it out of the box, it can be adjusting off full or partial charges without you even knowing it. So if I bring in my A35 and I basically say just let it run and write off everything that the system is set up to write off, I very well could be writing off timely filing, the full amount, and not even realize that you are. And basically that's the code that's in there. It said you didn't file it with the payer quick enough, so we're just going to adjust it off. The patient's not responsible. Sometimes it will actually skip the payer's adjustment. So if we don't want it to take that adjustment, we can set it to skip. We can move pay balances directly to the patient. Sometimes we want to do that. Other times it moves directly to the patient and we didn't want it to do that. And then the patient is getting a statement calling you going, why am I getting this bill? You billed my insurance. Well, there may have been a true denial that came in and that just forced it right over to patient without us knowing it. You can set a line item or even a claim level to just be appealed automatically, and we'll talk about how that can be set up for your workflow. You can have reason codes display on your patient statement or not display on your patient statement. So if you're not using, with your statements, if you don't want all the reason codes on your patient statement because that just confuses them more and they're calling you, then you go into your reason code library and you can determine, do I want this on my statement? Do I not want this to show on my statement? And then we can bundle our reason codes so that we have all those similar reason codes into one specific category or subcategory, and then we can start using that for efficient workflow and reporting. So the first thing with getting started, we just kind of covered, quickly what it is as far as the reason code library, but familiar yourself with your payer-specific reason codes. Understand what your payers, again, we have the HIPAA Okay, they're all supposed to be using the same ones, but we have very specific payers that even though it's supposed to be non-covered and here's what they should be using, they're using a different one. They're using that OA more than they should be using that. So familiarize yourself with your payers and what your payers are using. What is their most used reason codes? Determine how you want your codes to function. And this is really important. This is practice specific. I have clients who say, timely filing, I wanted to adjust it off. We missed the boat. I'm not going to even mess with it. I've got too many other things going on. We have clients that say, absolutely not. I want to appeal every timely filing. Needs additional information. I mean, how do you want to work that? So you have to determine for your practice, how do you want this to function so that your posters can post quickly and then somebody else is working the issues. Determine how you want your subgroups to work. When I talk a little bit deeper about subgroups, we're going to look at your workflow. You may have coding issues that you want to send directly to your coding team, but you may have demographic issues or patient is no longer covered by this insurance, and you may want that to go to an entire different group of people who are going to contact the patient to get updated insurance information from them. So by using these subgroups, you're able to move your workflow. It's not just a denial anymore. It's a denial that's going directly to the group that you need to fix that quickly and get it back out the door. So digging a little bit more, this is back in the Reason Code Library, and as I wanted to break apart what these different pieces mean, there's a lot of moving parts in here, and this is per every single code. You determine what you want it to do. So when we look at this, when it says force item to rebill option selected when you want to override the charge status and turn on the rebill indicator during the payment process. So if I had a code that came in that was CO97 and that's non-covered, if I wanted to just force it to rebill, I could force it to rebill, even though it's going to tell me non-covered, push the patient. Now be very careful with this one, because if you rebill it and nobody touches it, you're just going to rebill out the same exact claim and you're going to get the same exact denial. So this one is very cautious. I would say before you even click anything to force the item to rebill, you've got something set in place on what are you going to do with that, because otherwise you're just going to send the same claim back out the door. Right off the remaining balance option, if you want to just adjust it off to 0, this one again can be used if you're billing something that the insurance is going to force to patient responsibility always. If they're using a very specific reason code and you can say just write it off, I don't want the balance to stay on out to secondary or out to patient, you can do that. Again, be very cautious on how you use this one, because if a different payer is using that same reason code for something different, you may be adjusting things off that you don't want to adjust off. So you have to really watch, again, that's why I said know what your payers are using, what codes they're using. Is this going to work for my practice or not work for my practice? Display on the patient statements, that's where we basically stated we usually turn that on for all the patient responsibilities, co-pays, deductibles, so that when they get their statement, they can clearly see that it was applied to your deductible and they don't have to call and ask. Override the line item codes. We talked about the claim level, and if I want my claim level denial or my adjudication to override my line item, then I'm going to set it here and say, okay, even though this is a claim, I want it to override any line item codes. So again, used very sparingly. You want to make sure that if you are using that, you are watching really closely how it's actually functioning in your system with your payers. Now, if you're using contracts and you've got your payment allowed in your contracts as well, based on the reason codes, you can also check this one that says payment allowed option is selected when you want the payment to default to what is specified in the contract. By doing that, that's fine, but your ERA is going to come through with an allowable. And if your contract is different, you're now actually going to adjust your 835 to what's in your contract. So if you use this one, again, you're going to have to be really careful that all your contracts are up to date on a regular basis, because if you don't, what's going to happen is you're going to change this allowable to what's in the contract, although what's coming through the 835 may be the actual new allowable. So it's great to do if you're trying to track that. You can definitely say my contracts are up to date. I want to know if there's any issues, so I want my default allowable to change on my 835 to what's within my contract. The last one that we have here is the default to ERA credit balance creation, so that EPM automatically adds the reason code to a transaction during the ERA import process when a credit or negative balance for an encounter is created. Okay, that's a lot of verbiage. So really what it's looking at here is when you have those credits that come through, or you have the ERA credit balance creation, so you've got either a take back or something, and it's going to create a negative balance for an encounter that's created, or it's a duplicate payment. I mean, you can go ahead and say, let it go ahead and create, and then you can set up a work log task that can be created from this reason code. Now, a lot of clients actually set on their import of their 835, they basically will say, I don't want it to go ahead and post anything that's going to get a credit, because I want somebody manually to look at that before they actually do it. So there's a couple of ways to do this. I mean, again, if you're just letting everything post and the posters are not stopping, and you're just saying, I don't care that it's a credit, you can kind of go ahead and say this on here based on that reason code. And again, this is very reason code specific. I'm going to go ahead and allow it to do it, and then I'm going to create a work log task that's going to help me, find these and go back and make sure that if it created a credit or a negative balance on my encounter, then I can go back and work it. Now, the transaction detail status, and we're going to get into that a little bit deeper here. The transaction detail status is going to be where I can start determining what I want to do with these. Do I want to appeal it? Do I want to rebill it? Do I want to move it to the patient? So we'll dig into that, and that is an area that you definitely want to spend some time on, the detail status and what you want it to do. Okay, so the last couple of ones we have on the screen and what they're working on is the reason code category. This allows us to link my codes together. So if I have everything that is non-covered, so I have multiple codes that are being non-covered, I want them all into one category. So I look at this a little bit as a category, and then we kind of got a subgroup, so it's kind of a subgroup and a category together. But I want to take all my non-covered, and I want to be able to work them together or have a team work those. And I want to look at those and say, okay, we're going to make sure that we get claims out the door clean, and by using these categories I can start breaking and trending, and we'll look a little deeper into trending as well, but I can start determining by my reason codes where my issues are with my claims and how do I turn it around as quickly as possible. Now, the skip adjustment code option determines how to handle the adjustment code. This is where I said out of the box NextGen's Reason Code Library is going to set up to do not skip the adjustment. The verbiage on this, again, is a little confusing when you first read it. So do not skip the adjustment means take the adjustment. So if the payer comes back and says, we're adjusting off, you billed $200, I'm adjusting off $200, this code is set to take the adjustment. It does not skip the adjustment. But if I want it to skip the adjustment, then I have to do the drop down and say skip my ERA adjustment. Okay, I want it to skip the adjustment. I want somebody to look at it. I want to manually make that adjustment if I think it's correct. And then you also have a third option of using a $0 adjustment amount. Okay, so if they're telling you to write off $200, you can just skip that adjustment, or you could say use a $0 adjustment amount. Okay, depending on how you want that to work and how you want your reports to look and function. And I do know this is a lot of information, so if anybody has questions, we can throw them out at the end, or you can start putting them in the chat, and then we will answer them, and I'll come back to them at the end as well, too. So why should we make changes? First of all, the Reason Code Library, again, is going to follow the rules of the payers unless we change something in the library. The payers are tricky. There's no other word for it. They are out there. They are looking for ways to just pay you. They're not following the rules on a day-to-day basis like we'd like them to, even though they have one set of reason code library adjustment codes they're using, they're still not always coming through clean. So if you want your payers to control whether you're adjusting things on or off or not, then fine, you can leave it as it is. But if you want to control that, then you want to take some time and look at your reason code library and make sure that you're touching what you need to. Line items that you desire to be written off are often forced to patient responsibility. So I don't know if any of you, I hear all the time when I go out to clients is my patient gets a bill and then they're calling and they're yelling at us because when I posted it just automatically went to patient responsibility and I didn't know why. Again, there's a lot of codes out there that payers are now just saying, you know, we're not paying, force it to the patient, although, you know, you appeal it and the payer does pay it. So right now patients are getting a lot of statements on things that they really don't owe for. One of the other things we want to look at is the priority. Another area that's just kind of overlooked is we have all these reason codes. Most line item charges will have more than one reason code attached to the transaction. So we just talked about we have the remark codes, we can have line item codes, we can have claim level codes. So each reason code that we set up may have a different role to it. So we may have one set up for an M code that has a different role than my CO97 has. What happens is if the priority is not set correctly, then it's not going to follow the role that I want. So priority here does matter. So when you're in your reason code library, if you actually just right-click on your reason code report and you go to the reason code priority at the bottom, you need to be able to move up and down how you want this priority to work for you. And the priority is when I have that line item, my first reason code on the line item is the first code, second code, third code. So it depends on where that first code sits in this priority list on whether it's going to follow that role or my second code's role. Now, why I'm on the screen, because I don't have another screenshot, is if you want to see how your reason code library is set up now, just right-click on here and go to Print. And go ahead and print and take a look at your reason code library. Do you have everything set to adjust off? Do you have any roles set up? This will just give you a very quick visual of your reason code library and how things are set up in there. So it's basically going to take that first screen that I showed you and it's going to just print it out for you and you can export it to Excel and start taking a look at it. So my reason code priority list, once I jump in there, it's going to just, again, list all of my codes. Now, over to the right, I've got my big blue buttons, and I can move things up and down. So this is where I said if CO97 is in here, that it's included, but I have a PR32, dependent is not eligible. If PR32 was set on my line item as my first reason code, and I have a different role set for my PR32 than I have for a CO97, it's going to follow the role of CO97 because CO97 is the highest on my list. So this priority list is very important. So what we often see is that we set these roles up and then all of a sudden it doesn't follow the role that we expected it to. We go back to the 835, we look at the actual line item, and we see that we have 3 reason codes on it, and then we determine that the one reason code is sitting higher priority than the one that we wanted it to follow the role. So it is very important how these are sitting in here. Now, I would love to tell you this is easy. You can export it, set it up, and bring it back in. That doesn't work, and there is no easy way to do it besides taking the blue arrows and moving them up and moving them down. Once it's done, it's done. The other thing is anything that's new that comes in, if there's any new reason codes that come in, and we're going to talk about on the fly as well, they will always drop to the bottom. So anytime a new reason code comes in, it will be at the bottom of this priority list. So if you are allowing on the flies, you need to go in, you need to update your on the fly, and then you need to move it into the priority list where you want it to be. So a little bit about on-the-fly codes. Another thing that I see all the time is we've got this, HIPAA, we've got all these reason codes in here, and then all of a sudden they've got these new ones coming in that are just called on-the-fly. If you have your 835 library set up, that when you bring in your 835 files and you have on-the-fly turned on, that you allow this, anytime a payer sends any code that is not in your library, it's going to create a brand new one for you, and it's going to show up as on-the-fly. Okay, these are often remark codes, which are going to give you more definition on your denial. So you'll see your M codes and your N codes There'll be some new ones that pop in, and they'll just say on the fly that are giving you additional information. The other thing that we're seeing now all the time is we'll get an on the fly, and it, again, I'm going to go back to, it can be CO97, that, you know, maybe it was a line item CO97, and all of a sudden I've got another CO97 that comes through. Well, if you look at it when it comes through on the fly, it's probably sitting at claim level. So the payers are now sending things, instead of being line item, they're flipping them to be claim level. So you very well could have CO97 line item now and CO97 claim level. And that's real important to understand, because it's like, I already got this one in here. If you just go back and hide it and not look at those radio buttons, you're going to hide it, but it's going to come back again the next time it comes through on the claim level. On the fly should be monitored and updated immediately. If the payers are using these, you need to understand, first of all, if you're working your denials, what does it mean? So once it comes in on the fly, somebody needs to go into the Reason Code Library, go in and put the actual true description, what does this on the fly mean, and then set your role. Because again, on the fly have no roles. It's going to be out of the box. So if it comes in on the fly, it's going to take the full adjustment. It's no longer going to be appealed, and it's no longer going to fit in your subgroup if you're using subgrouping. The other option you have is you could turn on the fly off when you're bringing in your 835 files. If you turn that off, when you bring in your file, it's actually going to give you a comment that says reason code found. So if it comes through, it's going to say reason code unfound. It's still going to be in your 835 file that you import. You can still look at it, but it's not going to be in your NextGen system besides just saying unfound. So here's where I talked about a little bit on your remittance profile. If you have allow creation of reason codes on the fly setting, they will come through, and then they'll look in the reason code. They'll say like MA21 on the fly ERA. So it was brought in on your ERA and just as on the fly. That's where you want to go in, and you want to make sure that that description is updated and your roles are set. Now, posters, I did say on here that your posters to keep these up to date. Posters cannot keep these up to date. These are both settings in file maintenance. So your posters may see on the fly come through, but they're not going to be able to do anything to update it unless they have access to file maintenance to go back and update it. So a little bit here, I just wanted to kind of go through what we see. This is what we look at. This would be an 835 file that would come through. So this is kind of the encrypted file that we see. And over here, you're going to see that CO star 42, $25. That's the contractual obligation. And your PR2, $10. That's your patient responsibility, $10. So those are going to then dump, again, up on your actual transaction screen. You're going to see your billed amount, your paid amount. My CO45 was my contractual write-off. My transaction status, we talked about those statuses that we set. If I want it to go to appeal, then I want it to be set over here to appeal. And that's going to go ahead and leave that balance in that bucket of my insurance for me. If I want to settle it to the patient, then I want to tell it to automatically push any balance to the patient. So the transaction statuses you're going to be able to see, again, on your transaction screen, but you can force different transactions than what the payers want you to put here if you want to change it. If they're not telling you to appeal this, then you want to say, I do want to appeal this, and you want to force that in the role in the Reason Code Library to make sure it's set to appeal. Okay, so reason code categories and reports. So the whole purpose of setting up these subgroups is to be able to go ahead and take a whole group of reason codes and group them together into some kind of working subgroup so I can trend. And I can trend on reporting on what we need to do to get a clean claim out the door the first time. Denials take about, a denial is cost is what I've heard from MGMA. It's about $25 every time you have to work a denial. So we want to go ahead and make sure that you have clean claims and that the payers are actually doing what they're supposed to. So a couple of different reason code subgroups that you could create. And again, this is your practice specific, depending on how your workflow is. Are they requesting additional information? you know, no authorizations. If you're having a ton of issues with authorizations, you would want to take all those no auth reason codes and put them into one subgroup so if somebody could call and say, you know, we did get an authorization on this, it was just not paid. So these can be custom built. There's probably a few already in your system just from NextGen out of the box, but again, just because they're built, they've never been linked to a reason code, so you would have to attach them to the reason code. And then if you look to kind of the right here, I've got just that we can run different reports based on my reason code categories. So if I just want to look at my denials for additional information or for my CCI edit coding, I could pull that whole group of reason codes together quickly on a report without actually having to list every one of those reason codes. So trending, a little bit on how and why should I trend this at all. So we've got it all set up now. We've got it working. So now we want to monitor things and see. It's great to see how are my denials affecting my AR. Trend by line items. How many denials are your staff working? So that's another thing is if, you know, how many denials am I getting that are line item and my staff is constantly working these line item denials? Trend by percentages. Do you know how to identify denial issues? How do you fix the problem? You know, if you don't know where to begin with this and you're just constantly working denials, you know, do you have any ability to trend what type of denials you're getting in the system? So a couple of simple little, you know, I call them simple Excel reports. If anybody's done pivot tables at all or any kind of pivot graphs, what we've done is basically just ran a, you know, a canned report from NextGen saying, give me all my reason codes with the denials, and I've now got them grouped in my additional information required, my benefit max, my bundled, and we just started running these on a regular basis by dollar, and then we'll look at them by actual line items, and let me start trending them month to month to see where my biggest issues are. So, I mean, you know, two of my issues here, you know, in the sample is I've got additional information required and I've got non-covered review. But it's going to tell me that on an ongoing basis, the payers are denying my claims because they're requesting additional information. Now, is this information I need to send them on paper, or is something missing on my claim that's causing all these denials? But clearly, I've got an issue that I need to work towards getting cleaner claims out the door, or I'm going to continue to have all these denials with additional information. So then at the bottom, what I broke down was there's all kinds of things, all kinds of reason codes that need additional information. So, you know, we have the basic one, additional information required, but all these other reason codes, adjusted level of service not supported, adjusted paid off by another payer, just those are all needing additional information. So a lot of times we look at additional information required and we think it's just, you know, they need an op report or something, but it's just maybe it's COB and they need additional information from the other payer. So then you can start breaking it down on, okay, what was my biggest issue within that subgroup that caused me to have this high of a dollar amount, and you can look at the service lacks needs information. So that's basically telling me my claim is going out with missing information on it that the payer is looking for this to be paid. A lot of people like graphs. Physicians love graphs. So, you know, if you really are trying to look at something and you really want to see, do I have an issue in one area? Same report that I just had, if I take it and I graph it out, I mean, the first thing I'm going to look is, well, I really had a big issue with additional information in September. I've always had an issue with it, but I've had a huge issue. But great, look, October I fixed my issue. I no longer have that issue. We determined what it was, we fixed it, and then all of a sudden we had, you know, we dropped almost, you know, like $200,000 in denials in 1 month by finding my issue and making my claims clean going out the door the first time. So that's, you know, trending it and figuring out what the problem is, how the payers are denying your claims, why they're denying your claims. And sometimes it takes just contacting the payer and saying, you know, look, all of a sudden these are being denied. Why? What's missing? What is the problem? Where when you have individual people working your denials, they're just fixing it, sending it back out, but you're not able to trend what they've fixed. So I talked a little bit about trending and trending your denials as far as, you know, how many line items are your staff working? You know, everybody is buried on the back end of the AR trying to just get claims back out the door and working the AR. So again, trying to trend, what are they working on? So that additional information required was 2,302 line items, you know, for a couple of months. I mean, that's a lot of denials to be working when you're looking at line items. So again, that non-covered charge, I mean, know how many they're working. This is great for just employee productivity. If you're trying to really look at your employee productivity, how many are they getting through? Are they able to get through as many as you have? So same report, I just took the information and did it by line item versus by dollar. And then again, same report, we wanted to look at the percentage. We said, okay, I want to see what my percentages are. We're always talking about, low percentages and AR percentages and all these different things. So I wanted to look at, what are my percentages of non-covered? What are my percentages of additional information? Problem, I just brought it down, and then I can look at my next one. You're not going to be able to drill into each one and fix every problem immediately, but you want to start trending towards fix my biggest problem first and then get that under control and then move to my next issue. And then reviewing by financial class. Often we see that when I said you may need to pick up the phone and call the payer, often what we see is that all of a sudden this payer has just somewhat changed the roles, or they're denying something that they never denied before, and all of a sudden it's just lacking one piece of information that apparently you got a little email sometime back in all those thousands of emails you were supposed to change something and we missed it. So really understanding the payers. Aetna may not have a problem with any of those, and Blue Cross Blue Shield might all of a sudden have a big issue where it's the claim service lacks and needs information. So not only are you trending what your biggest problem is, trend it by your payers. Determine if it's just one specific payer that is causing these issues, and work with your customer rep if you have to, if it's something that you feel the claim is clean and they're just denying it to deny it. So kind of in summary, my goal today was just to help people understand the Reason Code Library, to give some visibility, I guess, to it. I do feel that it is really critical that the Reason Code Library is functioning the way you want. I see a lot of times when I go in and I watch ERA posting and everybody said it's not even any faster for me to do ERA posting because all I'm doing is manually posting everyone anyways, because I have to keep looking at it, and because it adjusted this off I have to fix that, or I want it to go here and it's not doing that. So if your posters are basically manually posting ERAs, it's because the Reason Code Library is not set up properly. And I say properly is how your practice wants it to function. It is not set up improperly. It's actually following the rules of the payers, but it's just not actually functioning for your practice. So talk to your posters. Your posters are the ones, and when I hear that all the time, is it just doesn't work, so that's why I'm not using it. It does work, it just has to be set up. So review the rules that you want to set to allow the payment posters of the ERs to be efficient. Everybody's practice is going to follow the rules a little bit different. We try not to set up a whole lot of Reason Code libraries. You could get a very specific payer Reason Code library. The more you create, the more you maintain. So if you can have one Reason Code library and you can get all your payers to kind of function within that one Reason Code library, it's better for you as far as maintaining it. Because as we looked at that priority and we looked at all these things on the fly, if you have to maintain 2 libraries, it's going to take, you're going to have to spend significant time on setting up 2 libraries, making sure they're working efficiently for you. Utilize the Reason Code categories for delegating your workload. Again, I'm a big fan of tasking and work log, and if I can use diagnosis or Reason Code categories, and I can immediately kick out anything that is a coding issue to the coding team, have them turn that around within 24 hours or 48 hours and back out the door. I don't want my coders to work on anything that's a denial because the patient switched insurance. I want to get that out to a team that's going to actually call the patient. So using those categories to delegate your workload is an excellent way to keep things being a little bit more proficient in your office. Create your denial reports utilizing the subgroups, trend things, and look for that clean claim, the first claim submission. Again, find your biggest one, work through that. It is a work in progress, but if you don't start on the first one that's causing the biggest issues, they're just going to always still go out the door, and you're just going to keep working denials over and over. The Reason Code library must always be maintained and kept up to date. I have been asked several times, when am I done building this? Never. Honestly, you want to always watch it. You want to trend it. If you've got it set up and it's functioning really well for you, I would always take on a quarterly basis, export that report, kind of glance through it, make sure that you see that it's still going to function the way you want it to function. So on a quarterly basis, you at least are looking at it from a high level that something hasn't slipped through the cracks. and that it's actually, you know, adjusting something off that you don't want it to. So that's kind of in summary the whole Reason Code Library. It can be a little bit of a dry piece of NextGen, but it really has a lot of functionality to it that I think is overlooked. So my goal today is to kind of get people to go back and take a look at it, see if it's set up, and if you are using it, you know, is there more that you can use it for?
Wow, that was a lot of information, Jeannie. Thank you so much for that. So I want to remind everybody that you can ask questions on the GoToWebinar control panel. You can type those in, and we'd be happy to read them out loud and answer them. You can also follow up with Jeannie if you have questions later. As you can see, your contact information is here. You can reply back to me when I email everybody later this week with a link to the copy of the recording as well as the PDF slides if you want to download them to reference later. You can reply back to me. I'll make sure that we get the questions answered that way as well. Follow us on social media, Facebook, LinkedIn, Twitter. We frequently do tech tip posts. Right now we're doing a countdown to ICD-10 and doing ICD-10 related posts every day. You can get some good stuff from there. Okay, first question. How do you run the Reason report?
I'm going to flip back slides, so hopefully I don't make anybody dizzy. Right here. If you go into the Reason Code Library, right click on here and go to your print. And I apologize, I meant to put a slide in on that. So once you go to print, I would go ahead and sort it by description, because if you sort it by description, then it's going to at least put like all your non-covered. So you'll see like OA non-covered, you'll see PI non-covered, CR non-covered, and that way they're all kind of together. So you'll be able to determine I have a role set for one of them, but I don't have the role set for all of my 97s.
Okay, thank you. Next question. One of the screens mentioned a report. One of the screens mentioned about a report to run on the fly. What report would we run on the fly? Just use print options?
For the report to see if you have anything on the fly, it is your daily posting adjustment report by reason code. And then the reason code, you can actually just move over the reason code that says on the fly. And if you run that, it's going to show you any reason codes that are sitting there sitting out there that are on the fly. The other way you can look at what's on the fly in your system is if you go to the HIPAA standard reason code, the priority list. If you scroll all the way to the bottom, your on the flies are all going to be kind of down towards the bottom.
Okay, thank you.
Hopefully that answered that question.
If not, feel free to reach out to us or type it in if you are looking for further clarification. Next question. When you have a code set up to appear or deny in the transaction detail status, how do you run a report to find these?
Okay, same report. It's going to kind of be, if you have it in a subgroup or the transaction, but it's going to be your daily payment. So it's your daily transaction by reason code is how you're going to get that report for denial or appeal. And you're going to actually do it by transaction status. And then you're going to pull over the status that you want, which would be appeal and denial. And I'm glad you brought that up, because I would recommend you use appeal and not use deny as your transaction status. I will not confirm, but deny had a lot of issues with not actually following the roles we wanted it to. So we just started using appeal all the time instead of deny. But your report, you should be able to pull over by transaction status and just pull your appeal or just your
Okay, thank you. As a reminder, we have an upcoming webinar on October 7th. A week before that webinar, we're going to be sending out an email invitation as we did with this one. Otherwise, if you want to register for it now while you're thinking about it, just go to itenov.com and go to our education and events page, and you can register for it there. We'll stay on one more minute if anybody has any more questions. Otherwise, here's Jeannie's information, and again, you can ask any of us, and we'll make sure that it gets to the right person. Oh, another question. Okay, I have had the following issue with Medicare and Medicaid patients. Medicaid does not pay the full co-insurance amount. If the co-insurance is $15, Texas Medicaid will only pay $3. An adjustment of $12 needs to be created. I do not know how to set up the reason code to create the $12 adjustment. When I tried it, the system created an adjustment from the full charge of -3. Is it possible to set the reason code to create only the $12 adjustment?
Very good question. We would have to really look at if you don't have your own reason code library for them, we'd have to look at exactly what reason code they're using. And you've already tried that question. I'm gonna have to look at that specifically, because there is a way, but I'm afraid that what it's going to do is adjust it off for somebody that you don't want it to adjust off for. But what I'm hearing is that you already tried to say just settle or adjust off so there's no balance, but it's not actually adjusting it off to no balance, it's adjusting off the wrong amount. And if that's the case, then we'd have to dig deeper into that, because it should not be doing that.
Okay, so Jeannie, do you maybe want to follow up with Ronaldo after this one-on-one?
Absolutely. Yep, absolutely.
Okay, perfect. Next question. At times when we post reason code C045, it will adjust off the whole charge amount when coming through our ERA, but nothing is paid. How can we stop this from happening?
Okay, so that very specific payer you would have to look at. So if they're saying contractual adjustment 45, is there another reason code with it that is adjusting the rest of it off? If it is all CO45 and they're adjusting the full amount off that you charged, then we have to go back and look at CO45 in your reason code library and make sure that there's nothing that states just right off the balance. So there's a couple of things that could be gone there. So I'd go back to CO45 in your reason code, look to see if there's anything that tells it to adjust it off. And then if on your actual report that's coming through your 835, if it's adjusting the full amount off there, and you actually look at the EOB and the EOB is not writing it off, then we have to look at your import and why it's coming in with a 0 and making you adjust the amount off. So we can follow, if you'd like, we can kind of take a look at that too. But sometimes we'll see an EOB that actually shows that the patient has a balance and here's the contractual, but then on the report that's imported in from 835 from your clearinghouse, it's actually not showing exactly what was on the EOB. And if that's the case, then we have to go back to the clearinghouse to make sure that the ERA is coming through clean.
Okay. Next question. Sorry, can you please repeat how to run that report for the appeal status? I hear daily payments.
Daily transactions, and this is me coming from memory because I don't have it pulled up in front of me. So daily transactions, and then it's either payments or adjustments, and then there's by reason codes. And then you get to reason code. You should be able, on the left-hand side column, you should have one that says transaction status.
Okay,
and
thanks,
I can send that to Chelsea too. So when she sends out the webinar, I'll just send the steps for that report.
How to do that. Okay, perfect.
Yep.
Okay, well that's all the questions that we have at the moment. Again, we'll hang on just another minute or two in case people are mid-typing right now. But in the meantime, thank you all for attending today. I hope that you were able to get something out of it, and please don't hesitate to follow up with any questions. We're here to help.
Yep. Thank you, everybody, for taking time. I know everybody's really busy right now. Go ICD-10, right? I just had to throw
How many days
again? 14.
Couldn't make it through without mentioning it.
If I can.
Well, it looks like most people are logging off, but Jeannie, let's hang out for just another minute in case people are mid-question. And again, I'll be sending out an email with copies of the webinar and the recordings, and also I always post those on Facebook, Twitter, LinkedIn as well. So feel free to look for them there if you're an eager beaver. Jeannie, thanks so much. That was a great in-depth presentation. So much information in it. You covered it in a very good amount of time, too. I'm impressed.
It is a lot of information. So thank you very much, and everybody have a great afternoon.
Thank you, guys. Have a great one. It looks like that's going to be it, Jeannie. So thanks again.
Okay, thanks.
Have a good day, everyone.